I have to be rather selective. All right. My name is Dr. Raj. For those of you who know me, good morning. For those of you who do not, welcome to my class, or our class. I've been working in conjunction with Mrs. Lambert so that I can bring in and introduce pathology to you a little bit and see as to what the big picture is. Now, due to the time restraint, there are only a few vitamins that I have time to go through. I want to be able to incorporate both biochemistry and pathology and see as to how the two meet. Real quick, the journey that you have undertaken at this point, as far as medicine, it's a beautiful journey. I've been awarded recently an MD, and it's probably the greatest gift that one can possibly receive. It's something that you will cherish, something that you will love for the rest of your life. If you do not develop that love from the beginning, it ends up being a very, very long trip. However, if you take the time to understand what you're learning, and if you take the time to love what you're doing, then the trip ends up being that much more enjoyable. Christina Rossetti says, does the road wind uphill all the way? Yes, to the very end. Will the day's journey take the whole long day from morn to night, my friend? Okay. All right, as far as objectives, we won't even have time to go through A, D, and C. There are differences between fat-soluble and water-soluble vitamins. I want to go through the mechanism of fat-soluble vitamins so that you understand as to how the malabsorption syndromes will take place and why you would become deficient. There are certain concepts which are general in medicine. Don't sit there and try to memorize everything because that's practically impossible. What you need to do is take these concepts and understand as to what's going on so that you can work things through. And that's basically what we're trying to do here. All right, the objectives that we use as a standard is known as the GRIPE objectives in pathology. Can you guys hear me? It's a GRIPE objectives, all right? And number 38 is nutrition diseases in the GRIPE objective. And let's get started. Dr. Smolenoff, I know, spoke of Casimir Funk. He was an individual who actually coined the term of vitamin. Once upon a time was known as amines, but later on came to find out that they're not at all. Vita means life, and you will see that many movies, one in which Anita Ekberg actually, I saw it particularly for this lecture. It's actually quite good. All right, functions, vitamin A, vitamin D. I'm going to go straight to the fat-soluble vitamins. It's ADEK, A-D-E-K. Vitamin A, vitamin D, vitamin E, vitamin K. Those are your fat-soluble vitamins. You have to know those inside and out. You'll have to know as to how they work, particularly, not just for biochem, but how it will affect you in a pathological manner. Now, as far as carbohydrates, digestion begins in where? In the mouth. As far as proteins, where does digestion of protein take place? It starts in the stomach. The digestion of fat, where does that take place? It does not happen in the mouth, does not take place in the stomach. It does not happen until it reaches the small intestine. It is fat. It is triglycerides. You have to know what the definition. Allow the terms to speak to you. Triglycerides. In other words, those are lipids. What does that mean? It is 3 fatty acids to the glycerol backbone. Okay, this is what you learned in biochemistry. You will have lipids with Dr. LaVille next week. We'll cover a little bit of physio. We'll do a little bit of endocrine with vitamin D. We'll try to put everything together so that it will make sense. All right, now, in the small intestine, we have a process known as emulsification. What does that mean? We have, remember hydrophobic and hydrophilic? You learned that back in first semester. We had polar heads in the membranes. If you have polar heads, is that hydrophilic or hydrophobic? It is hydrophilic if it's polar heads. If it's hydrophobic, that is in reference to having fear to water. That is the inner part of your membrane. When you take a look at fat, it is hydrophobic. Okay, so now you're in the small intestine. Why is it only that digestion of fat takes place in the small intestine? Because you need an alkaline type of nature. What is the pH in the stomach? Extremely low, extremely acidic. Fat does not get digested in the stomach when it's acidic. Fat will only be digested when it's in an alkaline nature. Now, where and who is providing that alkaline nature? Well, what is connected to the second part of the duodenum? You're talking about your common bile duct and your pancreatic duct, correct? Common bile duct coming from the gallbladder, obviously, and the pancreatic duct. Now, you have pancreatic juices, okay, particularly pancreatic lipase, which will come in and it will digest the fat. But in order to digest the fat, what type of environment? Alkaline environment. In order for lipase to work, it has to have a hydrophilic type of interaction. But what is fat? Fat is hydrophobic. Fat is hydrophobic, but in order for pancreatic lipase to work, it has to have a hydrophilic interaction. So who is going to provide that hydrophilic condition? The bile. Let's take a look at this. On your top left corner, that is your fat coming down. Now you're in the small intestine. That is your triglycerides. What are triglycerides? 3 fatty acids and 1 glycerol backbone. You need to break down the triglycerides. Who's going to break that down? The pancreatic lipase. Now, what is a missile? A missile is the triglyceride, which is now surrounded by your bile. Remember, you're in an alkaline environment. This is all in the lumen of the small intestine. You're in the lumen of the small intestine. Please pay attention. So now, you have the bile salts. It will surround the fat, and then you have the pancreatic lipase. Follow it down. Top left corner, second picture, is the lipase, which is now able to break down your fat. So you go triglycerides, and then remember, it's breaking down into what? It's going to take off 2 of the fatty acids and the monoglyceride. You will hear this again. Medicine's all about reinforcement. You're going to go over and over and over. I don't care as to how intelligent you are. You have to be able to reinforce this information. Okay, so now the triglycerides now is broken down into 2 fatty acids, and it will be broken down into a glycerol. This is then absorbed into the small intestine. All right, and this is all taking place. Remember, the process of digestion only begins in the small intestine. So this is rather interesting. If you take a look at the gross picture of the intestine, that's the small intestine right there. Do you see those white lines coming down? Those white lines. The only reason that you can even see those white lines is because those particular lymphatics, think about fat. Fat is a little bit different because it does not necessarily get absorbed into the blood immediately. It has to travel through the lymphatics and then to the thoracic duct, and then eventually it will be dumped off into the brachiocephalic vein. Anatomy, you've done this before, thoracic duct. And so if you take a look at the intestine right there, all right, you have these chylomicrons which are formed in the small intestine. You're inside the small intestine, and if you take a look at the picture on your far right, all right, that is a villi, or the mucosa of the intestine. And what you'll see here is that you will see as to how the chylomicron, which is now filled with your fat, will enter the lymphatic, and the lymphatic will then travel to your thoracic duct and then be dumped off into your blood. All right, so now, what is the point of all this? We're talking about vitamins. We're talking about fat-soluble vitamins. How does this all come into place? Well, see, the thing is, when you're having absorption of ADEK, your fat-soluble vitamins, this is the process, the mechanism in which these vitamins are being absorbed. So now let's take a look at some of these diseases that will affect it. All right. If you have problems with your pancreas, who's going to digest your fat? How are you going to absorb the fat-soluble vitamins? You need to digest it. So what's the first problem? Where's the first obstacle that you're going to come across? Your pancreas. Anything dealing with conditions of the pancreas. This could include pancreatitis, cystic fibrosis, Zollinger-Ellison. What does that mean? Don't memorize this stuff. You'll hear it time and time again. Zollinger-Ellison syndrome is a condition in which you have excess acid. So therefore, if you have excess acid in your small intestine, what's going to happen to fat absorption? It's going to decrease, because what type of environment do you need? An alkaline environment. Does that make sense? Biliary tract manifestations. What does that mean? That means that the bile, which is coming from a gallbladder, is going to be obstructed for one reason or another. This could be gallbladder stones, cholestasis, obstruction. So once again, if you don't have the bile, which is coming from the gallbladder, you're not going to cover the fat. You're not going to make it hydrophilic so that the pancreatic lipase, remember, you have all these things that are working together. It's beautiful. And we come to in the lumen, the enterocyte. The enterocyte, or the intestinal cell. You could have issues with that, such as celiac disease. Quite common back home. You talk about gluten-free diet. What does that mean? A gluten-free diet is a diet in which it is catered to those individuals that have celiac disease. You're hypersensitive to gluten. What does that do? It kills off the enterocyte, kills off the intestinal cells. If you kill off the intestinal cell, who the heck is going to absorb that fat-soluble vitamin? No one. It's going to go straight to your waist. Gone. Done. All right? See where I'm coming from? Pancreas, gallbladder, intestinal villi. Now, what about the we'll pass on the A beta lipoproteinemia now. You'll come across that later in biochem and path. Loss of mucosal surface. Well, this kind of makes sense. Short bowel syndrome. So if you have a short bowel congenitally or whatnot, or if you have bariatric surgery and you have decreased the surface area of absorption, guess what? Guess who's going to be affected? The fat-soluble vitamins. What are they? A, D, E, and K. Lamina propria, you can have Whipple disease. That's when you go into the histology of the intestine. Do you remember the lamina propria? Well, you could have macrophages which are stuffed in there. Get macrophages stuffed in there, and it prevents the absorption of your fat-soluble vitamins. That's Whipple. Lymphatic obstructions. You could have lymphomas. Where's the fat going? The fat's going to lymphatics. So if the lymphatics are blocked, maybe due to lymphoma, some type of tumor, well, guess what? Who's being affected? Not the water-soluble vitamins, but the fat-soluble vitamins. What are they again? A, D, and K. All right, so quickly. Beautiful picture up in Yellowstone, Grand Prismatic. That is an actual picture of beta-carotene. Bacteria, whatnot. That orange hue around the perimeter. Amazing as how nature works. Carotenoids, those are your beta-carotenes. Those are coming, as Mrs. Lambert has said, those are the vitamins. That is the vitamin A, which comes from vegetables. Whereas retinoids would include retinol and things that you need to pick up right now. Retinol, use the O because this is the transport form of vitamin A. O is for transport. Retinal is visual. A, all right, you're using the retinal for visual pigmentation. In particular, you need retinal so that you can form the rods. You hear about the rods and the cones in the eye. The cones are responsible for C's for color, C's for cones. That's for color. However, you need the retinal for the rods. What do the rods do? The rods are responsible for night vision, for dark vision. Does this make sense? If you do not have vitamin A in the form of retinal, you don't have rods. So what is that going to lead to? What type of blindness? Night blindness, because you can't make the rods. You can't make the rods. And then retinoic acid, you've heard that quite a bit as far as treatment for acne. So obviously retinoic acid is something dealing with the epithelial cells, dealing with skin. We'll see this in a second. This might possibly be the only vitamin we have time to go through. Meats. In meats, as Mrs. Lambert had mentioned already, preformed. Please know this, preformed. The animal has done the work for you. You already have preformed vitamin A. Whereas the vegetables, those are your carotenoids, that beautiful Yellowstone picture we saw. All right, that's your proform. That is a less potent form of vitamin A. Then where is this going to? This is all. Remember, where is the fat-soluble vitamins? So where's the first place that digestion is going to take place? Small intestine. What type of environment? Ah, yes, thank you. Alkaline, excellent. All right, where's the secretions? You're talking about bile. We're talking about pancreatic. So all of this is taking place in the intestine. Look at that. It makes perfect sense once you start understanding this. So you have intestinal, these take up the vitamin, this takes up the retinol. Remember, retinol, transport form, goes in intestinal cells. It's going to get packaged into chylomicrons. Chylomicrons are going to enter who? Where is it going to enter? The lymphatics. And then eventually it's going to be dumped off into the blood supply, and it will travel to the liver. The liver, the storage form of retinol. Remember, the transport form of vitamin A is retinol. The storage form of vitamin A is retinol esters. Must know that. Here, it is stored. Now, at this point, some of the places that it needs to go to, including the eye. What type of vitamin A is that? Good. And if it's going to the skin, retinoic acid. Excellent. All right. So now we have retinol binding proteins. You have to know this. Retinol binding proteins are produced in the liver, and it will bind to the retinol, and then it will take it to the various peripheral tissues. I just want to show you this particular slide, all right, in which I know that you haven't done anatomy of the eye yet, but I just want you to focus on here. Light will obviously travel through the cornea, through the pupil, refract over the lens, and fall back onto the retina. Here, please watch the screen. And the back of the eye, the surface, superficial, we have the retinal pigment epithelium, on the very superficial, the surface. Then you have the rods and the cones. Remember, the cones are responsible for color, but in particular, we are focusing on the retinal, which is responsible for the formation of rods. All right, so then here's a capillary. Here's a capillary, the transport form of retinol. The storage form is retinol ester. We're in the retinal pigment epithelium, which is once again here. in the back of the eye, the surface of the eye, and is then converted into, and I'll